Good morning and thank you for joining us. As you may recall, May is National Mental Health Awareness Month, and Roger Brubaker addressed you earlier this month to talk a little bit about mental health during the pandemic, and he is here today to provide a wrap-up of that and give you a few more points of consideration. So without further ado, Roger Brubaker.
Greetings, everyone. As Jason just shared, Mental Health Awareness Month is drawing to a close. But before it does, I want to take one last moment to discuss mental health during the pandemic. This time, though, I'd like to focus on human relationships and how they play a role in our mental health. I mean relationships with kin and strangers alike, people who we affect and who affect us. We are social animals, and the research shows that the way we perceive one another, relate to one another, the number of relationships we have, and the quality of those relationships all influence our mental health for better or worse. Before I do, though, I'd be remiss if I didn't acknowledge how we relate to one another in the U.S. right now. The past few years have been divisive. The U.S. appears deeply divided along ideological lines. Admittedly, the social science research demonstrates a complex, nuanced division, not as polarized as the one portrayed in the media, but a division nonetheless. It's not my goal today to diagnose the cause of these divisions or provide examples. It is my goal to acknowledge their existence, however, and to make an argument that if the pandemic has demonstrated anything to us, it's that these divisions won't serve us any longer. They never did. And I don't mean to simply gloss over the real differences and disparities that this pandemic has exposed yet again either. So how can we both acknowledge and hold space for the real differences and inequities between us to find what is common? What do we share? What experiences have we gone through these past few months that may help us look out and see other people like us doing their best to make sense of a new reality? How can we do so in a way that recognizes that what we think about and what we do influences not only our physical health, but our mental health? Some experiences that may help us establish common ground have been the struggles we have gone through and which may share common themes. We've had to gear up and steel ourselves for everyday errands like going to the grocery store or getting gas. We've felt fear of an invisible pathogen that threatens our safety and that we could be responsible for passing on to others. For many of us, our normal sense of comfort and safety has been stripped away. This can feel all the more maddening because the virus is still so poorly understood and many of the answers we want are still unavailable, making the future continuously uncertain. Many of us have forgotten what day it is or the obligations we have as time slips away slow and fast. We've been bored, and at the same time, we don't feel like we have enough time to get the things done. Many of our common rituals have been postponed, canceled, or the means to participate in them are simply unavailable. Celebrations, such as birthdays, anniversaries, graduations, have been disrupted. Weekly events, such as church and family meals, have moved online. And some of our most sacred rituals and events, births, weddings, funerals, have occurred in near isolation without the presence of friends and family to share in the joy or in the heartache. So as restrictions are lifted and we come back together in these new and old environments, how will we relate to one another? Will we practice empathy as an imaginative exercise? One in which we conceive that others are learning too, and regardless of their beliefs, that we share things in common with them. Will we extend grace to the person not wearing a mask at the grocery store? Will we not judge the person who remains nervous to go out in public despite eased restrictions and who requests that we wear a mask? I don't offer these thoughts as a moral imperative. This is related to mental health because the way we think of others and relate to them has direct consequences for our minds. The research essentially says this: if we stew on the behavior and ideas of others, we will likely feel disconnected and unwell. If we imagine others as people with rich, complicated beliefs and values, like us. Going through common joys and struggles, we are more likely to feel connected, supported, and healthy. We all need compassion these days, whether it comes from others or ourselves. Hopefully we can be generous enough to provide both. Are there holes in this argument? Of course. Is it kind of sentimental? Yep. Does it speak to all populations? Of course not. It's not always easy or safe to build relationships with others, but our health depends on it, and the continued health of our community depends on it. So as this month draws to an end, I continue to encourage everyone to check in on their mental health, discuss mental health with others, and think about how relationships play a role in your life and wellness. We are making new choices every day to promote community physical health. I encourage everyone to work equally hard to promote community mental health as well. Thanks.
Thank you, Roger. And I am so grateful that mental health has been part of the conversation around the pandemic from the get-go. Certainly not everyone has been actually contracted COVID-19, but everyone has been impacted, and mental health has certainly been one of those impacts. And so that empathy message is something that I think we can take forward, especially since this will be a process. Certainly around the EOC, we've called it a marathon, not a sprint. So it is important that we continue to look to our mental health and give that attention. I'd like to give you a brief case update, then followed by an update regarding our Sentinel Testing program. So we only have 66 cases still. We announced the new case back on Friday, and that is still our current number. That new case is a person in their 40s from the Eugene-Springfield area. They are recovering at their residence currently. Of our cases, we have one presumptive case. We have 27 individuals who are under monitoring right now. Those are individuals who have been identified through contact tracing and are being asked to stay home for the time being. We have 9,494 tests that have come from our local labs and have been sent to process. We have nobody currently in the hospital, which is fantastic news. We have 61 individuals who have recovered. We only have 4 individuals who are sick at home. To date, our Sentinel testing program, we started off, as you remember, with testing our unhoused community in various different congregate settings in that community. Then we moved on to assisted living facilities. We did 3 assisted living facilities last week. We have 3 more scheduled for this week. And then next up, we have the Latinx community. So we are looking at 2 different locations to do about 4 hours of testing on each location for the Latinx community, and that will enable us to have a better understanding about what is going on with COVID-19 in that community. At this time, I'll take any questions from the media.
Kennedy with KEZI has 2 questions. The first, how is the county doing in terms of hitting the mark for possible phase 2 reopening?
So Kennedy from KZI asks, how is the county doing in terms of hitting the mark for possible phase 2 reopening? Great question, Kennedy. So while it's still too soon to tell about all the different marks, we do know that the cases that we're seeing are the kind of cases that we want to be seeing. They are relegated to those sort of clusters, and they're predominantly related. And then we're also picking people up on asymptomatic testing, which is also good news, because that means that those individuals we're preventing them from spreading throughout the rest of the community. Our PPE is in a solid place. And as you can see, we had 1 hospitalization. Now we're back down to 0 hospitalizations. So our hospital system is also doing well. So right now, in this moment, we are doing well. However, again, it is too soon to tell. We'll revisit that as we approach that mark about when we would move to phase 2.
What can be shown when it comes to flu cases within the county and a comparison or impact in relation to COVID-19?
So Kennedy's second question is what can be shown in regards to flu cases in Lane County and its relation to COVID-19. So you can always look at the Oregon Health Authority's website. They actually monitor flu activity. It's called Flu Bites. And that uses a system called Essence, and I think we've mentioned that. Essence looks at all respiratory conditions and monitors inpatient and outpatient activity, and we can get a sense of how many people in our community, in our county, and in the state are experiencing flu. It also, we look at positive flu testing as well. Flu tests are generally tested the same way that COVID is tested, or very similar, with what's called a PCR test. And just like COVID, we don't test everybody. It's predominantly looking at the more severe cases that end up getting tested. Of that data right now, we know that we had a high degree of flu in our community in January and February, and then it really, we saw that influx and that sort of peak, if you will, happening in March. There was a previous peak of flu back in January, so that's what we call a bimodal peak, meaning that there were two peaks. And right now, the flu activity does seem to be tapering off. I think what we're looking at right now in terms of flu is next year's flu season. Flu season typically lasts from October to April, May, so pretty much half the year or most of the year. And we will be anxiously preparing for the flu season probably earlier this year, and really wanting to make sure that we are sort of looking at the flu and COVID at the same time.
Sam Broadway with KEPW. Has the agency advised St. Vincent de Paul not to increase the number of beds at dusk to dawn or otherwise, even with using plastic dividers?
So Sam from KEPW here in Eugene asks, has the agency, I'm assuming public health, advised St. Vincent de Paul regarding dusk to dawn capacity and the protocol that they have in place to keep people healthy there? So Sam, to our knowledge, St. Vincent de Paul is following all Oregon Health Authority protocols. We've been working with them. However, you would probably need to reach out to St. Vincent de Paul to hear exactly what they're doing. That's really their purview.
Any more questions?
And that's all we have. Thank you for joining us.